For doctors, getting information quickly can help save lives. So having the most reliable network really matters. Verizon lets them monitor patients at home and use real-time video to consult with colleagues. Keeping patients healthy is what drives doctors. Being their partner drives us.
Hi, welcome to Telehealth Connection TV, brought to you by Verizon for HIMSS TV. I'm Kat Drusich, Senior Editor at Healthcare IT News, here with Jabari Butler, Chief Information Officer at the Healing Community Center in Atlanta and a member of the Forbes Technology Council. Jabari, thank you so much for joining me today. Maybe you could get us started by just telling us a little bit about the center and what services you offer to the community.
The center is called the Healing Community Center, and it was started by Dr. Charles Moore, and he is a physician currently practicing, and he actually started helping people right out of his trunk. Actually, he would go to different places around different parts of Atlanta, impoverished places in Atlanta, and he would help people right out of his Subaru. And at the time, he had a heart for people, who still does, and it started from that vision. And I remember when he told me about this some time ago, and he said, "All right, I'd like you to help us with the IT." And at the time, IT was a little closet in a warehouse setting. And I think it had a fax machine in it. I wasn't sure about the phone, but it had a fax machine. And so he says, one day this is going to be all over the place, and we're going to help people all over the place. And so since that time, I've been a fan, and that was many years ago. Since that time, we've serviced thousands and thousands of people in the metro Atlanta area, in the areas of primary health care, pediatrics, dental. And so we have a number of other types of things that we do on the health wellness side as well. We've had that before, and other initiatives that we've worked with other schools. And we've worked with Emory recently just to do some studies that they conducted with the new site that we have that's actually in the middle of being built. And so these are some things that we actually worked with. And over the years, it has grown from just a few patients to now thousands.
I know that the Healing Community Center has started to offer telehealth to its patients. So I'm wondering if you could just talk us through what that rollout looked like and what tools you decided to use and how you decided to start using telehealth for your patients in the first place.
Well, telehealth was something that we always had available through our eClinicalWorks application, which is our EHR, or electronic health record system. And so when COVID hit, that actually accelerated efforts. That was really the push to roll out telehealth. And so once that took place, we started to think about alternative ways to see patients during the lockdown. Once that took place, we immediately worked with our medical team, me with the technology team, along with the operations and finance. We came together as an entire organization. And we decided to say, okay, what types of things do we need to do to turn this on, and then get everybody acclimated to the technology, and then at the same time, get it rolled out all during a lockdown, because we realized that some people had to stay at home, and we realized that some people would be considered part of vulnerable population. And so And this was at the beginning where things were unknown, so we really weren't sure. And then we actually had to depend as well on regulations. What kind of regulations will we have to follow to do it? And it was good that the government decided to ease up some of the restrictions that were originally in place on the kinds of technology that we could use. So we took all those things into consideration, and then we came out with the technology, and then we were able to roll it out. What's interesting is that we ended up having to enroll it in as part of another change in infrastructure, and that was being able to offer people support and services that's different than your typical telehealth situation. The technology is designed to have a patient to provider interaction.
Mhm.
But the way our organization works, it also requires the participation of your intake people, your front desk people, intake people. There's a full chain of people that are also involved in the process. So we had to modify the operations around that.
Can you talk a little bit more about that? How did that modification work? What were some of the specific technologies that you ended up using to fit the workflow that you'd already established?
Well, some of the modifications were, as I mentioned earlier, the infrastructure. That was the main one. So we had to look at how are we going to be able to service the patients and have a portion of our staff work remote, because we had to shut down a portion of our operations early, throughout the time period. And so when that happened, that meant that we had to figure out how can we allow the process to go forward and have people work both in the clinic and outside the clinic. So certain days we were actually working all throughout the day, and then a portion of it we had to shut down at a certain time of the day. But operations needed to keep going in order to comply with things that were happening here. So we had to take a look at how do we work with a remote staff? How do we keep patients, being seen with telehealth, and have a cloud-based infrastructure support operating a fully operational clinic with people all over the city, as if it was all in one place. And so that was a unique challenge. So it worked, but I think the advantage was the fact that we were already cloud-based. I think early on, when I first started with Heal, I intentionally designed the technology infrastructure to be able to expand quickly, to be able to grow quickly if we needed to, which meant that we have VoIP phones, and we would have internet technology that's robust all over the place with Wi-Fi. And so there's lots of infrastructure that we already had, having mostly cloud-based, cloud-based applications. So that allowed us to be able to move in a way that was quick and efficient, and it didn't require people to have additional extra training above beyond the application. They could use the way they normally used it with slight modifications wherever they were, so that when a patient would make a phone call, then the patient could call and they'll still reach somebody, but they may be somewhere across town, and then that person would route the patient to the provider who's somewhere else across town. And all of them would be in their own unique, safe place. But to the patient, it was just, hey, I'm being seen. Someone's helping me. So I think being able to have a cloud-based infrastructure that was safe and secure and robust with industry strength technology to back it, and also to have an operations team and have a executive leadership I could work with that understands those unique challenges, allowed us to be able to work with the organization, to work with the people, and make it flexible enough to respond to those unique challenges that happened during the lockdown.
Definitely. You've mentioned a few of the unique challenges that you faced at Healing. I'm wondering what some of the other challenges maybe other federally qualified health centers might face in implementing a telehealth program, and what lessons they might take away from your rollout.
Sure. I think that one of the things that may be significant across organizations is the idea of having to operate in a way that's virtual. Typically, organizations want to work with people face to face. Now, virtual and telehealth has been out a very long time. That's not a new thing. It just so happened that everyone had to get thrown into the whole idea of telehealth at the same time. And I think that accelerated, the challenges in terms of being able to adopt it fast all across the board, across everything that you do, versus before it might have been one or two, appointments here or there, going from that to something where you almost had to do virtual like all the time. I think that was a bit different. The other one is also infrastructure. Some may have infrastructure situations. Oftentimes organizations, particularly our size, typically do not have an IT professional at this level as a CIO, they typically aren't part of the organization. So they may have maybe another support person that they call on, or they're shared with somebody else, or they have to seek some kind of consulting services elsewhere. So they typically don't have this type of structure. I was very fortunate to have leadership that recognized the importance of technology early on, back in 7+ years ago. I was very fortunate to have enough leadership to say we value technology in a way that we think is important to the organization. I think the other thing is that, again, they don't have a person at my level, and they don't have a person at my level that reports to a CEO directly without someone in between. More oftentimes than not, we're typically placed up under some other unit, and we don't get a chance to speak directly to executive leadership. It gets filtered through someone else. And I think that's extremely important. I think before it used to be perhaps an option, and technology was seen more or less as a utility. You just turn it on, turn it off, you judge it, you manage it the same way you manage the rest of your bills. And I think some of that still exists. I think some of that mindset still exists. And it's relegated down to maybe Wi-Fi and an EHR application, but it's much, much more than that. HIPAA tells you it's much, much more than that. And these other organizations that are regulating bodies will tell you it's much, much more than that. And so I think to have a resource like that at a strategic level, not just at a technical level, is extremely important, especially now. I think before you could get away with it 10 years ago or even 5 years ago because cyber security wasn't as hot a topic. Now it's one of the top things to dominate. I think we were just talking about this on a Forbes list, and we were kind of bouncing around the top 5 technologies to dominate this year in 2021. And one of them was cybersecurity across the board, cybersecurity. So when you don't have someone at an executive level or at a high management level that can talk directly to a CEO or an executive director, then it can be challenging because sometimes that information may not get filtered properly, or the urgency behind it may not get filtered properly. So I think having the executive sponsorship and access to have those conversations is important. The other thing is patience. So you may have infrastructure on your side. You might have the right types of tools, the technology, the funding, everything you have to service people on one side. But then on the other side, what we found that can typically be unique, or it could be something that happens across the board in certain places in the city, is that our patients oftentimes did not have the right technology or the right internet bandwidth to be able to receive the telehealth. It didn't happen all the time, but it happened. It did happen. And sometimes it's just the idea that some people might not have been very familiar with the technology enough to even use it. So they may have had it, but they didn't know how to use it. So we anticipated that could happen. In anticipation of that, we learned from the Georgia PCA, which is Primary Care Association. We relied heavily on their technology and expertise as well, and some other organizations that we work with, to kind of learn what kinds of things can we best be prepared for. And so we learned that you can take a position where you would train the front end staff, perhaps the folks that answer the calls, people that route the calls. We have a call center. We would equip them with learning how to navigate the app, how to navigate the system. Even though we have a support team that's able to help patients, and even ECW has a support team to help patients, oftentimes their first point of contact is going to be that call center. So one of our practice managers at the time took the initiative to start working with our front end folks, because we said, hey, we're going to have to train them, we're going to have to equip them with some of the things that they may need to help the patients with. So they kind of turned into more or less help desk people, and so they knew about the application. So they learned how to do the application. They learn how to navigate the application. They learn how to work with the application. And I think that helped quite a bit. And they themselves walked through what it was like to be a patient. So training up front with the different scenarios is what we did as well. If you face certain scenarios, what do you do? How do you help someone? And so by them taking themselves through that process, then they were able to help up front work with the patient and then get them through our service process, if you will.
Before we wrap up, are there any successes that you want to talk about that you're proud of having achieved through telehealth at Healing Community Center?
Absolutely. I like to thank our donors, and we have many donors who help fund this initiative. I think the combination between private and public funding is a great formula for success. And there's no I in team. It was teamwork that did it. So I think that to do more, working with partners of that magnitude allowed us to be able to leverage the resources that we had, strengthen our resources, and then be able to give the types of services that our patients deserve. And I think that one of the things that I'm very thankful for is that we had executive staff who was strong and on board. We had a wonderful medical staff and administrative staff who continued to work with us, our dental team and all the other teams that work with us. It was true teamwork. And that's one of the things that we pride ourselves in at HEAL is teamwork. And it really works because I think that having the right mix of the private and the public funding, along with our staff working in concert with the patients, that gives us the best chance to be able to be successful. Because if we're successful, then we get to have people healthier and they get a chance to have a more positive outlook on life. And so I think overall, just being able to have those types of funding sources to be able to supplement what we do to provide the patients with the best care, those I think are the great things to be proud of. I also want to help folks understand that the technology is not just technology without the processes and the people that go along with it. And many times we tend to look at just the technology, tech side of it. But as I remind people often is that it takes three components. Any tech professional will tell you that there's people, there's process, and there's technology. It's like a three-legged stool. Without one, the others fall. And so when we work with technology, the people in the process, if they're there, then that allows the entire solution to become successful. When one of those are missing, then you're set up for failure. And so I think that there's no way to get around making mistakes and challenges. I mean, you're going to have those, but the best way to be able to navigate it is to have those components in place. And those are things that we continue to work on, and we continue to do that. And then that allows us to be successful.
And thanks so much for watching Telehealth Connection TV, brought to you by Verizon for HIMSS TV.
For doctors, getting information quickly can help save lives. So having the most reliable network really matters. Verizon lets them monitor patients at home and use real-time video to consult with colleagues. Keeping patients healthy is what drives doctors. Being their partner drives us.